Our office is on Tulane Avenue at 2601 Tulane Avenue, and then we also have an office we call the CAN office, our Community Awareness Network, on Frenchman. And those are two of the permanent sites where we have counseling and testing. We also have a mobile medical unit where we go out into the community 4 days a week where we can do counseling and testing. In the French Quarter, we also have several businesses and bars that we will provide testing in once or twice a week, once or twice a month. I'm sorry.
Well, when you mentioned CAN, I had made notes that under your section called Education/Prevention, you list a number of things, and I'm just going to read through them and then tell us about some of those.
Sure.
And one of them was the CAN, HIV counseling and testing. I think we probably talked about that. South POL. What is POL?
Popular Opinion Leader.
All right. Project Alive, wellness management, condom availability, revision, and outreach. Now, talk about some of those things.
These are all program names centered around HIV prevention. The Centers for Disease Control provides dollars to communities, to states and community-based organizations to do prevention education. But the CDC has taken a turn to look at interventions that we call them DEBIs, or the diffusion of behavioral interventions that have been scientifically proven to make a difference. When the epidemic first came out, we used to do health education. We'd go out and talk about HIV and AIDS, how it's transmitted, how it's not transmitted. But the data has shown that really didn't slow down the progression. It made people aware, but it didn't get people to change behavior. So now we're looking at interventions that actually have an impact and get people to change behavior to reduce the risk of transmission. So many of these programs are those behavioral interventions that are aimed at actually getting people to slow down, think about HIV, and do something to change behavior that might either reduce or eliminate the risk of transmission in the future. Our Popular Opinion Leader model is a science-based model where we provide education to. It was demonstrated first in gay bars, where the bartenders or the popular opinion leaders were educated on HIV, and we tried to get them to engage in conversation so that the norm in the community might be to talk about risk reduction, as opposed to meeting, picking up people, going home. But start talking about risk reduction and how can we reduce the risk of transmission if we're going to engage in sexual activity. With this intervention, we're actually adapting it to online chat rooms, where we're recruiting popular opinion leaders to actually go into chat rooms and engage in conversation about HIV transmission and how to reduce the risk of transmission.
And how do you locate these leaders to recruit them?
As we go into the chat rooms, as the conversations start to develop, you start the staff start to get a sense of who might be the engaged individuals that have an interest in this, and will follow up and want to volunteer to continue programming. Some of the other programs we have our revision program. Is a program geared at young gay and bisexual men, and the intervention is called Empowerment, but it provides a social network for young gay and bisexual men outside of bars. We bring them together in a social venue. We have a core group of youth that actually develop the programming of what the group might be doing, going bowling, pizza party, developing a fundraiser event. But it brings people together, and we can interweave HIV risk reduction messages and interventions.
And are you doing that just in New Orleans or in the other parishes as well?
No AIDS is just doing it in New Orleans. We do have other agencies throughout Louisiana that have the empowerment intervention going on. There's Lafayette, Monroe, or two other empowerment programs that are going on in Louisiana. Not No AIDS, but other agencies.
Initially, it was thought that this was exclusively a male homosexual ailment, which of course is not the case. But now, does no AIDS in most of what we've been talking about had to do with homosexual men? I assume that you now have women who now use your facilities.
Yes, absolutely. Although most of our prevention programs are targeting men who have sex with men, we have other organizations in the New Orleans area that are also doing prevention work targeting various populations. On the care side and treatment side, in the New Orleans area, we see about 70% of the people living with HIV are men, about 30% are women. We do have both men and women coming into our organization for clinical care as well as supportive services. People that are receiving services or people living with HIV are reflective of the community. We have people who are coming from the gay community as well as the heterosexual community, people of various races. In New Orleans, there are several organizations that provide services, and we're fortunate to have a program called FACES, which is a program of Children's Hospital, and they target women, adolescents, and children. And they provide the case management supportive services for many of the women living with HIV. But and No AIDS will provide this case management services for many of the adult men. But we also have other programs like our food program where many women are accessing services. We have a pantry as well as a home delivered meals program. We have support groups where we see both men and women come into support programs. As well as our clinical services, we see both men and women come in.
It sounds like what you're doing requires a sizable staff. How many people do you have?
Our staff has grown to about 80, I think 84 as of this week.
That's a considerable number.
It is, and we've seen a great bit of growth following the effects of Katrina. We're at a point in time where we thought we'd have to close the agency because many of the federal funds or the flow of cash that came into the agency became caught up in some bureaucracy or things that weren't happening because of everything that was going on at the time. But since then, we've been able to identify additional resources to help with cash flow. We've brought on new federal programs. We've got a SAMHSA program, which is substance abuse, mental health program where we're providing outpatient intensive treatment for people who are living with HIV and substance use. So that was a large new federal grant that came into the organization. We've had additional funding to be able to enhance or build our clinic, where we've grown from a small clinic of about 200 clients to now providing health care for over 800 people living with HIV.
How many? 800. That's a lot of people to care for.
So we've seen the staff increase because of these new programming.
So are the incidents of newly acquired HIV, are they diminishing or are they growing?
The past couple of years, it's been about the same throughout Louisiana. I think we're seeing probably about 1,100 new cases or new people that are diagnosed with HIV.
And are these generally people who just did not take the required precautions, or people who didn't know they were transmitting it, or what? It's alarming that the growth is continuing.
I think for most people who have HIV or find out about their HIV, they may have engaged in some type of behavior that have put them at risk. I think the whole issue around prevention and slowing down or stopping the transmission rate, many in our communities, many across America know about HIV. We know how to not transmit HIV.
Yes.
But many of us feel like we're invincible, or that that doesn't affect me because I'm not gay, I'm not a drug user, I'm not, fill in the blank. But people engage in behavior because either they feel they may not be at risk, or sometimes we don't make good judgments when we're drinking, drugging. Our inhibitions go out of the window, and even though we know that we might be putting ourselves at risk, we may not make good choices. So when we're talking about change of behavior, that becomes a very, very a difficult thing to do. It's easy to provide education, it's easy to provide awareness, but it's very difficult to get people to change behavior.